The news from Victoria this morning on new coronavirus cases has not been as promising as the previous few days, but authorities have said Wednesday figures for some reason often prove higher than others, and you have to look at the averages over several days. And yet more families are dealing with the loss of loved ones over the past 24 hours because of this coronavirus outbreak in Victoria. Reporter Steph Ferrier joins us now from Melbourne. Steph, so it feels like the last few days with new coronavirus cases numbers have lifted spirits. This morning, not so much, but at least it's not a massive jump.
Yes, there is at least that we can take stock in that, Joe, that we haven't gone in a massive spike or anything like that above 100. And as you mentioned, we do have to remind ourselves that Wednesday has traditionally been seen as a spike day. That is because often the labs might be closed over the weekend, and so then they're trying to catch up. And sometimes on Wednesday and Thursday, we do see a slight uplift in numbers. But of course, this is the third day in a row that it's gone up. We've gone up from 41 to 55 and now to 76 new cases. So I guess that might make people feel a little bit uneasy, particularly when we have to get to that magical 50 or fewer cases before we can get out of these extended lockdowns from the 28th of September. But as you say, we've got to really look at those 7-day averages. So they are now 72 for that 7-day average compared with 95 7 days prior to that. I've got a 14-day average of 83.7 at the moment, but I think that that figure is going to be adjusted because I've just used the raw numbers that are issued with press releases and Twitter every day for the past 14 days. And I think that the Department of Health actually readjusts those figures because, of course, there's a lot that are reclassified in these cases as well. So that is probably likely later on to come down to a lower figure. As you mentioned, the death toll continues to increase. Sadly, we've had another 11 deaths recorded in the past 24 hours. We're yet to find out whether or not they all happened in the past 24 hours or if some of those are lagging indicators from aged care centres finally reporting some of those figures. But that does take our death toll up to 694. Now, it's also important to remember that yesterday's testing numbers were only 7,800, so it could actually be that we had quite an increase in those testing numbers that this 76 comes from.
Yeah. And so Victorian health officials are being sent to Sydney to determine if there are lessons to be learnt from the New South Wales contact tracing system. The Premier and the Chief Health Officer there in Victoria had staunchly defended the Victorian setup with contact tracing, saying that it wasn't substandard to New South Wales. Is the Premier and the Chief Health Officer standing by that, or is there some concession that there are things to be learned now?
Well, the Premier did say in his press conference yesterday a little bit of a concession in that he was saying that they are always looking for continuous improvement. You'll remember that the federal government has held up New South Wales as the gold standard, and of course now we've got our chief scientist and senior health officials heading over to Sydney later this week. The Premier says just to double and triple check to see whether or not things might be able to be improved here. However, he was again at pains to point out that Sydney is a completely different proposition to Melbourne because you have far fewer case numbers over there and far fewer mystery cases as well compared with Melbourne. At the same time, he was also copping a little bit of a grilling and did say that when he was asked whether or not the contact tracing team had been disbanded between the first and the second waves, he didn't actually answer that directly. He just said that the problem is that when you think you've beaten this virus and clearly you later learn that you haven't, then you've got to learn something out of that. So we are hearing these sorts of words about lessons learned. The other thing that we are hearing as well is that they are also going to emulate what New South Wales has had for a long-standing situation, which is these locally embedded contact tracing teams. The Premier announced that there'd be 5 suburban response centres or units, particularly in some of those coronavirus hotspots. He did say that this was emulating successes in regional Victoria, not necessarily from New South Wales experience, but this is something that the federal government has been banging on about as well in relation to the fact that they are decentralised, and that has helped them get on top of outbreaks faster. And that's something that experts have also mentioned as well, with some local doctors here in Melbourne's West saying that the contact tracing had been woeful, and so they took it upon themselves to do it themselves as well. We've also heard information from the person who put together this roadmap, the lead researcher from the University of Melbourne, who modelled all of these key criteria dates. And he's also said to Radio National that apparently they weren't asked by the state government to model on recent improvements to contact tracing. So that wasn't put into account when you've got these thresholds and these long-standing dates that we've got to get to in terms of the hurdles that we have to pass to get out of infections, out of these restrictions as well. So that is another interesting point too.
OK, we'll leave there, Steph Ferrier in Melbourne. And we haven't got a time on that Daniel Andrews media conference yet today, but we'll bring that to you live here on the ABC News channel a little later on. The Deputy Chief Medical Officer federally says safety is being prioritised after a trial of a leading coronavirus vaccine was suspended. Phase 3 trials of the Oxford University vaccine being developed with the pharmaceutical company AstraZeneca have been halted as part of a routine action after a participant had a serious adverse reaction. The Australian government this week signed a deal to manufacture the vaccine domestically if it proves successful. Dr Nick Coatsworth says halting trials is a standard process when concerns over a negative reaction arise.
In a way, this reinforces that despite the accelerated nature of vaccine development, safety is at the forefront of everybody's mind. And it would be a fairly standard process if there's if there's a severe reaction and they're not sure whether it's attributable to the vaccine or not, to gather all the information and halt the trial for the moment. We've got to keep in mind that tens of thousands of people have now received this Oxford vaccine. So this is a testimony to the rigour and the safety focus that people are putting on vaccine development. Obviously, we'll see what happens with these reports out for the Oxford vaccine, and it by no means puts that vaccine completely off the table. But that is a reason why the Australian government is investing in multiple technologies, multiple potential vaccine candidates, and we know that not all of them are going to go to market, and that's why we've got so many different vaccine candidates, I believe over 160 around the world at the moment that are being tested.
Nick Coatsworth there, the Federal Deputy Chief Health Officer. Norman Swan is the host of the ABC's Coronacast, and he joins us now from Sydney. Norman, good morning. So first of all, give us some background to this AstraZeneca candidate vaccine. Where was this trial at and how promising had it been?
According to the reports, this was a patient in the UK. So there's two phases, if you like, to the phase 3 study for the Astra vaccine. The phase 2, phase 3, this means it's dose finding and whether it works and its safety, was started in Brazil, South Africa and the United Kingdom a couple of months ago, maybe 6 or 8 weeks ago. And they were recruiting 17,000 people in that phase 2, phase 3 study. Interestingly, the US part of that trial, which is important for getting registration for the vaccine in the United States, has only just begun on 80 sites, and they're aiming for the remainder of about 35,000 people. So it's they're aiming for a 50,000 person trial. And it was a patient in the UK who got this reaction.
Yeah, and so take us through what's happened.
Well, we don't know what's happened. It hasn't been made absolutely clear. So remember, in a vaccine trial, this is a two-dose vaccine. This is a two-dose study against placebo. The placebo is a meningococcal bacteria, so that people don't know, so that they feel that there's been they've had a real immunization. So it's not a complete dummy immunization. So then that's important to realize. And when you get a reaction like this, they've got to break the code. They've got to find out whether or not this person who got the reaction has had the so-called placebo, but it's really the meningococcal vaccine versus the COVID-19 vaccine. And then they've got to work out, because if you're studying 17, it's not tens of thousands, as Nick Coatsworth said, it's about 17,000, still a lot of people. Somebody's going to get a heart attack, somebody's going to get pneumonia, somebody's going to break their leg. You've got to work out just whether or not this is the play of chance or something that's feasibly attributable to the vaccine. So there's a bit of work to be done to actually chase that down. The one reaction that they're looking for, that scares the vaccine makers, is called is an antibody-dependent enhancement reaction, ADE, which is really the immune system overreacting when somebody gets exposed to the real virus. That's what happened with SARS-1, and that's a fairly recognizable phenomenon. That's what they're going to be looking for. But if it's something like random, like a heart attack or something like that, then it's unlikely to be anything of any to be worried about. So this is not a case that we should really be terribly worried about this vaccine at the moment. They've done the right thing. We've got to find out, and 9 out of 10 vaccines fail.
Yeah, and so it could be the case that this will not disrupt in a big way this particular process if it's unrelated to the vaccine.
It won't. So they'll come to the conclusion whether or not it was related. The difficulty they've got is if it was related to the vaccine. So if they've got a serious immune response to this vaccine, then they may have to throw in the towel. But if it's one that's really random that you would expect to, occurs by the play of chance, they'll continue the trial. But I think that the US recruitment sites have been put on hold, and I'm not sure whether they've finished recruiting yet in Brazil, South Africa, and the UK, but that'll be put on hold. And hopefully it's only going to take them a day or two to find out what's going on.
Yeah. So where does this leave the deal that the Australian government struck the other day?
Well, it leaves it. They will presumably continue apace to try and set up the manufacturing for this, in the hope that this won't this won't stop the trial. But it was always a gamble. That's not a criticism of the government. They've got to take a gamble here on what works and what might work and what doesn't. They're also spending money at last on the University of Queensland vaccine, and that's a promising vaccine as well. And then it's not entirely hopeless with the other vaccines. If the Moderna one works, which is a very novel vaccine injecting a substance called mRNA into the body to get the cells to produce the COVID-19 fragments of the COVID-19 virus, then I think there are manufacturers around the world producing this vaccine, and we should be able to acquire it from overseas. So all is not lost. I'm not sure it's exactly true that the government is investing in multiple vaccine technologies, but they are investing in some.
Yeah, but I guess this is just a bit of a wake-up call. This might not kill this particular research on this vaccine, but it's a wake-up call as to the hurdles that all these candidate vaccines are going to face.
That's absolutely right. And you might note that in the last day or so, 9 pharmaceutical companies, I think it's 9, have come together in a pact to say they will not release their vaccine under political pressure. I'm not talking about the Australian government, I'm talking about the US government here, where President Trump has promised a vaccine before the November election. They will not do that if there's a safety concern. That's all we need is people not to trust the vaccine. We have to trust the vaccines that come on the market, that they are safe. And if that requires a few more months of patience, that's what we've got to do.
And Norman, when this all started back in February, March, I remember interviewing experts and saying the earliest we could expect a vaccine, if at all, was going to be within 18 months. What's your read at this stage on the earliest possible availability of a vaccine with the progress of the trials at the moment?
Depends whether you're talking internationally or here in Australia. I mean, I think it would be brave to say that it's going to be earlier than June, July of next year. There will be one. I'm pretty sure that there'll be a couple of vaccines available in 2021. It's just a question of when and whether they're sure that they're safe and that we can get access to doses.
Yeah. And Norman, just while we've got you, I'm interested to hear your reaction to this latest daily information out of Victoria this morning. 76 new cases. We're told over and over again not to focus too much on these daily numbers, but putting that in the context of what we've seen in Victoria over the past week or so, how are you feeling about those numbers there in Victoria today?
I think that there's cause for concern. You should be looking at the daily average, but it's going in the wrong direction. I think there are problems with their contact tracing system, not the contact tracers. They're doing it tough psychologically. They feel responsible for this, for the system in which they're working. It's just not being, it's clear that it's not been fit for purpose, too slow. They've got to get to a point where you can get a test result in a matter of hours. Contact tracers are onto it. They've nailed the contacts within 24 hours and you're moving on. And I don't think that we're there. There's still a big backlog in Victoria, and they're paying the price. And nearly 50% of cases yesterday were healthcare workers, aged care and hospitals. So we haven't nailed that either. If you subtract that 50%, then Victoria looks pretty good in terms of community spread. But you can't subtract healthcare workers from this. So there's multiple flaws in the system. And those flaws, by the way, and weaknesses can occur in other jurisdictions. It's just that they haven't been stress tested. Look at New South Wales and Queensland. They've had outbreaks in hospitals as well.
Yeah. OK, we'll leave there. Norman Swan in Sydney.
You're welcome, Joe.
A pub in Sydney's inner west will be closed for a week over coronavirus safety breaches. Reporter Alexia Atwood joins us now from Balmain. So, Alexia, what's the name of this pub and what's happened there?
Joe, well, it's the Unity Hall Hotel pub in Balmain, and it's been shut for breaching COVID-19 rules until the 16th of September. A member of the public dobbed them in. Police went in and saw that they were hosting 2 birthday parties. One had a group booking of 32 people. Now, the rule in New South Wales is that you can only have a group booking of 10. And there was dancing and there were people drinking, milling around, not observing physical distancing. The police did later confirm that with CCTV vision as well. And the pub also had been caught out the day before, also for breaching rules. So they have been shut down. They did put a post up on Facebook where they apologised unreservedly. They said that they found it challenging to follow all the different aspects of the changing rules, but that they should have understood it better, and that they say that the health authorities' standards are extremely high, but they understand the consequences if they aren't that high. I've been chatting to locals in Balmain this morning. Some have said that it's too harsh a penalty and, you know, dancing, can't we just get back to normal? But other people say, look, we're in a pandemic and these are the rules and you need to follow them. Let's take a listen.
Well, we all know what the rules are, so, you know, if they don't follow the rules, then they've got to expect to get themselves into trouble.
We all need to exercise some self-discipline and self-control during this epidemic, and I think that if people are doing the wrong thing by the rest of us, they should pay the price.
Today on what's happening with a few hospitals in New South Wales.
Last reporting period, we found out about 2 new workers at the Concord Emergency Department that have tested positive. So that means that now across the Concord Hospital and then the Liverpool Hospital, there are 7 new cases of coronavirus, which is causing some authorities some concern, and that meant that 100 staff have had to go into quarantine. The elective surgery at Concord Hospital, that's been cancelled. The visitors aren't allowed to go there, but the New South Wales Health Minister, Brad Hazzard, said he isn't too concerned because they were able to backfill the staff, and the risk at Concord Hospital is not there anymore. It's gone through a deep clean. But we've also got another big group of people isolating at King Koppel at Rose Bay. 100 students there are in isolation and 30 staff. And we've got health alerts issued for all across the city. And this is just the nature of the pandemic right now. And Gladys Berejiklian was asked about this earlier, about all these health alerts. So let's take a listen to what she had to say.
Every day when health puts out in real time information about venues or schools, that's a positive because it means that information is getting out and the community can respond accordingly. That's how we've been managing the virus since we came out of that shutdown period in March. And to date, it's proved successful. It is a daily battle, but I'd much rather have this balance than shutting everything down, because I don't think that's the way to manage a pandemic. So lots of comparisons obviously being made between Victoria and New South Wales right now.
New South Wales being called the gold standard for testing, and Gladys Berejiklian says she's happy with the strategy going forward, and she does not want to go into lockdown.
Okay, Alexia Atwood reporting there from Sydney. A school at Ipswich, west of Brisbane, has closed after a student tested positive for coronavirus. St Edmunds College says a Year 11 student tested positive yesterday, and the campus will be closed for at least 48 hours for cleaning and contact tracing. All parents have been contacted.